Good morning, everyone, and welcome. It's another episode of Fertility Talk. We are still talking about miscarriage for the month of April, and this morning we're talking about the nutritional aspect behind miscarriages. And our topic this morning are what foods are protective against miscarriage. And we are talking to Francette Bekker. Francette Bekker is a registered dietitian, but I'm going to have her introduce herself. Welcome, Francette. Thank you for joining us, and
Thank
please
you.
introduce
Thank you so
yourself.
much, Leanne. It's always so nice to join you for these talks. So, as she said, I'm a registered dietitian. I specialize in fertility and pregnancy. I'm based in Midrand, Pretoria, and I also consult online.
Perfect. Thank you very much. So like I said, we mentioned we're talking about nutrition, and that's always very important. It's always something that's asked about. Is it something that I ate that caused my miscarriage? So our first question, before we get into that, the first question we have is, can poor nutrition increase the risk of having a miscarriage?
Okay, so yeah, let's talk about this. I think it's a question many women have actually asked themselves. And with miscarriage, there are so many unanswered questions and, lots of self-blame.
Yeah.
But let's say, yes, there are certain cases where there might be a disease condition or dietary factors that can cause a consistent lack of nutrients that's needed to sustain that pregnancy. And then there's also the case of the harmful exposure to certain substances. So we can talk through those a little bit. But Leanne, throughout this talk, I actually want to empower and support couples with knowledge and
Mm.
things to do because we are often so hard on ourselves and we take the blame for things that's completely out of our control.
Yeah.
So let's focus on what can be done. Let's keep this really positive because it is such a painful subject actually to
Yeah.
talk about. So I just want to backtrack a little bit to before the time of the miscarriage. So we've talked about this before, but to be able to fall pregnant, we need to have the egg and we need to have the sperm. And we know the 3 months before we actually fall pregnant is so important when we look at the diet and the lifestyle and also the health of the couple. So we don't need just the healthy egg and the sperm, but we just need it to be of great quality also. All right, so the 3 months before falling pregnant is going to be really important, and that will ultimately influence the quality of the embryo. And you've had lots of great talks about miscarriage already. We know that age is a factor, there are genetic factors also, but we know the lifestyle is also a really important factor. So the quality of the embryo will then actually help the development of the embryo during that embryonic stage, and then also that fetal development that's going to follow. So I want to work through some cases where nutrition might not be optimal, and I just want to create awareness so that couples can have these conversations with their medical teams. So first of all, we might have a case where a person might be suffering from a medical condition that would also need dietary intervention. So here we're thinking about things like diabetes, PCOS, thyroid dysfunction, clotting disorders, and a very important dietary one would also be celiac disease. It's often not diagnosed, but in many cases it might be the reason for and the cause of recurrent miscarriages. So those would be medical conditions that also require some dietary intervention. And then we might have a case where someone might be excluding one or more food group from their diet. So this might be personal preferences. Let's say someone is maybe vegetarian or vegan, might even be allergies or intolerances. So that would be something that we might have to address and just look at extra nutrients or supplementation. And then we also get gastrointestinal disorders. I think this was not really known. So I
Mm.
just wanted to mention that. So that would be, for example, Crohn's disease, ulcerative colitis. Maybe someone's had surgery for a disease and they've had a certain section of the stomach or the intestines removed. Or these days, we've got many patients who go for bariatric weight loss surgery. So in these cases, that person will not be able to absorb 100% of their nutrition. So they are actually high risk people when they are falling pregnant. So we need to chat to the women about this, right? So that's quite important. And then we get the case of a very poor or restrictive diet. So one that comes to mind would be morning sickness, but now I'm talking about severe morning sickness, where the woman can actually not retain enough nutrients and she's really falling behind. I would really encourage you to reach out to your medical team. And then also many women who fall pregnant, they might have eating disorders. We actually don't talk about this enough, but women who have anorexia and bulimia, they're still falling pregnant. So that can cause increased risk for miscarriage. And then one that's also not talked about enough is food insecurity. So maybe people don't know what that is, but it's actually a condition of not having access to either enough food or good quality food to sustain your basic needs. And that's unfortunately a reality also. So that can increase the risk of miscarriage,
Miscarriages.
unfortunately.
Wow.
Then we've got food safety. So I think when you obviously pregnant, you try and keep your, your choices healthy and safe,
Yes.
but not everyone's maybe so vigilant about this. So we've got Listeria, Salmonella, also heavy metals. And with heavy metals, I just want to mention that some of the powders and shakes, they might not be safety controlled. So they might actually contain some extra heavy metals. So we just need to be careful of that. You know about the endocrine disrupting chemicals, and also sometimes we actually have to cease foods and herbal teas and some supplements before we, when we're pregnant, we can't continue those during the pregnancy. Um, and then there's obviously documented research that shows increased risk of miscarriage with regular or high alcohol consumption, also with drug use and smoking. And then this one's really interesting, also with caffeine. So the research actually shows when a woman consumes more than 300 milligrams of caffeine a day, it increases the risk of miscarriage by 40%.
Wow.
And that is about 3 cups of coffee or 6 cups of tea. So that's something that we must really be aware of, because that's why it's so important to reduce
Yes,
caffeine
yes, yes.
when we fall pregnant. And then I just quickly want to mention, we talked about men and male infertility a few weeks ago.
Yes,
So obviously
yes.
for all of this, it also applies to the men, because in some cases it might be male factors contributing to miscarriage. So we have to also investigate that. And then if someone listening to this talk have any of these conditions, or if they find themselves in any of these situations that we've mentioned, please reach out to your medical team and also seek the advice of a prenatal dietitian that actually specializes in pregnancy nutrition, so that they can evaluate your macro and your micronutrient intake.
Wow, thank you very much, Francette. We ready for the second question?
Yes,
Okay,
let's go for
so
it.
our next question is, what foods are protective against miscarriage? This is quite a nice one.
Yes, yeah, this is really a nice one, and there is actually quite a bit of research to support this. And I found this, and I actually think it's really empowering to couples to actually focus on this. So let's work through the list. The first one is actually eggs. So the research then recommends to have eggs at least twice a week, and that can actually decrease the risk of miscarriage. And obviously, we just need to also consider the salmonella risk. We need to have properly cooked eggs. And then we have fish. Also, this was quite interesting. They found then that eating fish twice a week actually decreases the risk of miscarriage by up to 30% in
Wow.
women eating fish compared to women not eating fish at all. And then obviously we want to stay away from those high mercury containing fish, not the ones that we really eat, but it would be things like shark and swordfish, and also just basically those deep sea fish.
Yes,
Obviously they're really high in mercury. So it might be if someone's husband, actually is a deep sea fisher and they have that quite often, then that would be a
yes.
conversation to have, not for our regular people who don't live by the sea. And then this is really empowering also vegetables. So
Yeah.
the study actually found that when women would eat a cup of vegetables every day, they would decrease their risk of miscarriage by 40% compared to
Wow.
women who only ate maybe half or less than half a cup of vegetables a day. So, and they specifically talked about the green leafy
Yes,
vegetables
yes.
there. So that was quite interesting. And then also dairy products, you can decrease your risk of miscarriage up to 30% by having dairy every day. So dairy would be milk and yogurt, and also cheese. We specifically go for the hard cheese when we're pregnant to prevent the risk of listeria. And then the last one here that I've got is fruit. So this was massive. The researchers actually found that by eating 2 pieces of fruit a day decreased the risk of miscarriage by 70%. That is
Wow.
quite massive.
Wow.
And then just a short note, there are also other protective nutrients that can protect against miscarriage. I'll just mention them quickly.
Yeah.
So we've got omega-3 and then also vitamin B3. It is called niacin, also choline and vitamin D. Lots of people actually do suffer from a vitamin D deficiency. It's something
Yeah.
that your doctor can test for. And then the last interesting one is folate. So we've got a group of high risk pregnancies that would be people maybe living with overweight and obesity, diabetes, many other conditions where we would actually have to supplement more than the average amount of folate and folic acid. So really reach out to your medical team and just check if you are one of those cases that would actually need an individualized dose for the
Yeah.
folate and folic acid. So most of these nutrients that I've mentioned, like the omega-3 and the niacin, we don't want to actually add extra supplements while we are pregnant because that can also
Yeah.
be dangerous. We want to really have a food first approach, and that's what I do in my practice. We really want to get this from food first
Yeah.
before the supplements.
Perfect. Thank you so very much. That was very interesting. Um, can I please ask you if anyone wants to get hold of you, how do they get hold of you, Francette?
Yeah, so the easiest would be on Instagram or Facebook. My page is at Francette Dietitian. You can just send me a direct message there, and my email address is also on that page.
Perfect. Thank you. And I think it's chat with Francette Bekker or it's chat
Yes,
with.
that's the email address. It's chat
Perfect.
with at francetdietitian.com.
Perfect. Thank you very much. So thank you for joining us today. I really appreciate your time to do this talk with me. So
Thank
if
you,
anyone want to
Leanne.
get hold of Francette, if you are someone that has been dealing with miscarriages and you want to just go through it with her, she is based in Gauteng, but I know you also do online as well. Consultations, you are welcome to contact her. And she's also got a listing on Fertility Solutions. So you can go under dietitians and you can find her details there. But thank you very much for today. I really
Thank
appreciate
you,
this.
Leanne.
Thank you
Thank you,
very
and
much.
have a lovely day. See
You
you.
too.
Bye-bye.
Bye.